So just how big of a deal is this? Well, let's start with a number. 500,000. That's how many people in the US alone are affected by this every single year. I mean, think about that for a second. That's like the entire population of a major city, all dealing with this silent threat.
And yeah, the consequences, they can be really, really serious. In fact, it's the third most common cardiovascular cause of death here in the United States. It's right up there behind heart attacks and strokes. So let's be clear, this is a major, major health threat we're talking about.
So, okay, that brings up some pretty big questions, right? Like, what is actually happening inside the body? And where does this thing even come from? How does this dangerous journey get started in the first place? Well, that's exactly what we're going to unpack right now.
All right, first things first, we've got to understand the villain of our story here, the blood clot. And like any good origin story, this one, well, it doesn't begin where you'd probably expect.
So let's get down to basics. What exactly is a pulmonary embolism? It's pretty straightforward. It's a blockage, an obstruction in one of the arteries in your lungs. But here's the kicker. The key phrase to remember is traveled from elsewhere, because the problem almost never starts in the lungs themselves. And you might be surprised where these clots actually come from. I mean, look at this. A whopping 95% of them start out in the peripheral veins. We're talking about what's known as a deep vein thrombosis, or a DVT for short. So why there? Why the legs? Well, it's because those big, deep veins are where blood flow can get sluggish, kind of slow down, and that creates the perfect little environment for a clot to start forming.
Okay, so what causes these clots to form in the first place? It's not just random chance. Doctors have this thing called Virchow's triad. Think of it as the perfect storm, or a recipe for disaster with 3 key ingredients. First up, slow blood flow. This can happen if you're on bed rest for a long time. Second, thickened blood, maybe due to things like pregnancy or certain meds. And third, an injury to the vein wall itself, maybe from some kind of trauma. Now, you don't need all 3, but man, having even one of these really bumps up the risk. All right, now let's get to the next chapter of the story. So, you've got this clot that's formed down in the leg. What happens next? Well, now it's ready to start its dangerous journey, making its way up toward the lungs. And this is the critical moment. A little piece of that DVT, that clot in the leg, just breaks free. As soon as it's on the move, traveling through your bloodstream, it gets a new name, an embolus, and it is officially on the go. So this embolus, it's traveling up through the veins, it goes right through the heart, and then bam, it enters the pulmonary artery. That's the main highway that carries blood to your lungs to pick up oxygen. And this is where it gets lodged, creating a sudden, massive traffic jam. Everything just stops.
Now, the immediate problem here is the insane amount of pressure this puts on your heart. Your heart's right side is suddenly trying to pump blood against what's basically a brick wall. And that causes this intense, dangerous strain on the heart muscle. If that blockage is big enough, the heart, it just can't win that fight. It can't overcome the pressure, and it starts to fail. Okay, so given how incredibly dangerous this is, how does your body even signal that something is seriously wrong? Let's talk about the red flags. These are the warning signs that, honestly, everyone should know about.
So the symptoms you'd feel really depend on how big that clot is. For a medium-sized embolus, you might get dyspnea. That's just the medical term for feeling short of breath. And tachycardia, which means your heart is beating way too fast. You might also get a really sharp chest pain, especially when you take a deep breath. But a massive embolus? Oh, that's a whole different beast. Now we're talking about sudden, severe chest pain that feels a lot like a heart attack, along with signs of shock and what's called acute right ventricular failure. Basically, the right side of your heart just gives out. So when someone shows up at the hospital with these kinds of symptoms, it immediately becomes a race against the clock. The next step is a full-on medical investigation, with doctors using some really specific tools to find this hidden threat. Which really makes you wonder, right? How in the world do you find a clot that you can't even see, one that's hidden deep inside someone's chest?
Well, doctors start by looking for initial clues. First, there's a blood test called a D-dimer. It's a fantastic first step because it looks for a substance that gets released when a clot breaks down. So if that test comes back negative, that's a really good sign there's probably no major clot. Then an ECG can show that super fast heart rate we mentioned, and other blood tests for things like troponin and BMP can tell them if the heart is already under a lot of strain.
But look, to get the definitive answer, to actually see the blockage with their own eyes, they need to bring out the big guns. They need the gold standard imaging test.
And that test is called a CT pulmonary angiography, or CTPA. It's a special kind of CT scan. They inject a contrast dye that literally lights up the pulmonary arteries on the screen. It gives doctors a crystal clear, absolutely undeniable picture of exactly where that clot is hiding.
Okay, so once the diagnosis is confirmed, everything shifts. The focus immediately turns to fighting back. It's all about treating the clot that's already there, and just as importantly, preventing any new ones from showing up.
The treatment approach really has three main parts. The foundation, the absolute cornerstone, is anticoagulation. You probably know these as blood thinners. Now think of them less like something that dissolves the current clot and more like traffic controllers. They stop the existing pileup from getting worse and prevent new ones from starting. Now for the really severe, high-risk cases, doctors might use something called thrombolysis. These are powerful clot-busting drugs that go in and actively break down the clot. And of course, for anyone at high risk, prevention is everything.
So after all this, what's the big takeaway? You know, the source material says it perfectly. A high index of suspicion is needed in high-risk patients. And what that really means is, because a PE can be so subtle and its symptoms can look like a lot of other things, you just have to be aware. It's so critical. For patients, it's about knowing the risks. For doctors, it's about always keeping this possibility on their radar. Because when you're dealing with this silent traveler, catching it early and treating it fast, that is absolutely everything.